Okay, welcome to Living Sickle Smart with Sickle Cell Foundation of Minnesota. I am Ray Blaylark, your host. We have another exciting session coming up for you, and we are talking with Dr. Hannah Lichtsinn about navigating primary care. Before we get totally started, let's just make sure we do our proper introductions. And I'm sharing my screen. It might take a second to pop up on your screen. But again, we want to welcome you to the 2021 Living Sickle Smart series. We want to thank our sponsors, Be the Match, Bluebird Bio, and Novartis. Without them, many of these sessions would not be possible. So we are so appreciative for our sponsors and partners in this work. Just a reminder that you can view previous and future sessions of the Living Sickle Smart virtual education series on our website. Our website's going to point you right back to our YouTube channel. So we kind of recommend that you just go straight to the YouTube channel and then be sure to sign up to subscribe to our YouTube channel so you know when we post new sessions. And then if you want to be aware of when our live sessions are, as well as any other events that we have in the community, you can also subscribe to our Eventbrite channel. On either one, either YouTube or Eventbrite, you can search for us under Sickle Cell MN or Sickle Cell Foundation of Minnesota, and we should pop right up. Just a reminder that Be the Match has a new Sickle Cell Warrior resource package, and we are incredibly excited about it. You can order a free package at SickleCellConnect.com. Order one for yourself or your person that's living with sickle cell disease. But if you're a provider, share this resource with your patients. Make sure that they know what's out there for them. Excellent information, as well as connection to the Be the Match organization. Now, today, as I said, we are super, super excited to have Dr. Hannah Lichtsinn. She is with Hennepin Healthcare. She is a primary care doctor, med-peds. What that means is that she has studied pediatric medicine and adult medicine and has combined that into the true expertise that comes with having a foot in both worlds. So it's actually quite wonderful that she's a internal medicine doctor and primary care doctor with that level of experience. I'm going to formally read to you her bio because she's such an amazing doctor. As I said, Hannah is a primary care pediatrician and internal medicine doctor at Hennepin Healthcare in Minneapolis, Minnesota. She is developing a multidisciplinary sickle cell treatment program at Hennepin, where she sees patients both in the primary care and hematology clinic. She completed medical school and residency training at the University of Minnesota and has been caring for sickle cell patients in a primary care setting for the past 6 years. She participated in the American Society of Hematology, that's ASH, y'all, Sickle Cell Disease Center's workshop, and serves as a medical advisor to the Sickle Cell Data Collection Program at the Minnesota Department of Health. Hannah is a personal friend of mine as well as a colleague, and I'm super excited to have her on this session of our Living Sickle Smart. So without further ado, I am going to turn it over to Hannah, and I'm going to join at the end and have more discussion. If you have questions or comments that you'd like to add, if you're seeing this on Facebook Live, feel free to add something in the comment box. If you are seeing this as a replay or an on-demand webinar, please feel free to email us at info@sicklecellmn.org. Hannah, take it away.
Well, thank you so much. And it's so good to see you. We don't see each other nearly often enough, but I know you're about to disappear. So let me.
Can't hear you, can't hear you.
so sorry. I was chatting with you and you didn't even know. So thank you so much for that introduction, Ray. It's good to see you. We should see each other more often and not just on Zoom. And thank you everybody who's watching, and welcome this morning or afternoon or evening, depending on what time it is for you. So like Ray said, I am Hannah Lichtsinn. I am a primary care doctor and sickle cell doctor too. And I'm going to be talking about transition and how to make the most of primary care. So how to, what is primary care, and how it's can be really important and helpful in getting the care you need with sickle cell, especially during that transition time. So I work at Hennepin Healthcare. I am an assistant professor at the University of Minnesota. And if you're on Twitter, you can follow me at Dr. Licks. Oh, right. So, the goals, the things I want to talk about today are three different things. So I want to talk about what the role of a primary care doctor is, especially related to being part of your sickle cell care team, kind of during transition, before transition, after transition to adult care. And I want to talk about the differences that we see and that we experience between the worlds of pediatric healthcare and adult healthcare, because the systems are different, the approaches to care are different, and I want to talk about that. And then identify some strategies that you can use for building your own sickle cell care team in a multidisciplinary way. So those are my goals. Those are the things I want to talk about with you today. But first, I want to do some introduction. So I call this also known as, who is this lady and why should I listen to a word that she says? So who am I? Like I said, and like Ray said, I am a primary care doctor. That means that I work in a clinic. I don't work in the hospital. And my job as a primary care doctor is to make sure that any patient I'm seeing, anybody, sickle cell or otherwise, has all of their healthcare needs met. Now, sometimes I'm able to meet those needs myself. Sometimes I'm not, and I rely on a specialist to help meet those needs. But either way, my job is to make sure that my patient is as healthy as they can be. And for the past 6 or 7 years, I lose track of time, I have been doing that specifically for people who have sickle cell. So I am not a hematologist, and I want to be really clear about that and what that means. So I did not do a fellowship. I did not do training in hematology oncology. My learning, my knowledge about sickle cell comes from independent learning, reading on my own, talking to experts, working with experts, and from my patients. So I have, a lot of experience in caring for people with sickle cell, though I am not a hematologist. And I think that is a really important distinction. And I think that having someone on your care team or your child's care team or the care team of whoever you love who has sickle cell, because I assume you love somebody who has sickle cell if you're watching this video, it's important to have somebody on that team who thinks more broadly, who thinks beyond just the sickle cell, beyond just that aspect of someone's health. So that's why, even though I'm not a hematologist, I think it's really, really helpful and really, really important to work with a team, work with somebody who thinks differently sometimes. And so that's who I am. And Ray can vouch for me, I think, a little bit if it comes to that. But I really believe very strongly that it's important to have multiple different types of caregivers, types of experts on the team taking care of you when you have a complex illness like sickle cell. And so that's why primary care is so important. Now, because we're streaming this the way we are, I can't see you, I'm not talking to you directly, but I'm just going to say that I'm talking as though you are someone living with sickle cell, or someone who loves someone who has sickle cell, someone who cares for somebody who has sickle cell. That's who I imagine you to be as I give this talk. And please, if you are live streaming, share your questions so that Ray can pass them on to me. I'm happy to take breaks at any point to talk about things. So with that, let's go on a little bit. So I want to define a couple things so that we're all on the same page as far as what words mean, what different things mean as we talk about care in the primary care setting. So first of all, transition. You know, that's the whole theme of December here in Living SickleSMART. But what is it? So transition broadly means a lot of different things. It's any sort of change. So a change from one thing to another. So we have a lot of transitions in our life, transitioning from spring to summer. Like how we live is different in the springtime and the wintertime than in the summertime. Transition from high school to college, transition from living with your parents to living independently. Those are all transitions that people experience in their lives. When I think about transition in a healthcare setting, I think about a very specific thing. This is the transition from getting healthcare in a pediatric setting to getting healthcare in an adult focused setting. And that's a really specific thing. And there will be a specific day when every patient stops going to the pediatric clinic or the children's hospital and starts going to an adult clinic or an adult hospital. I don't think of that as transition. That is like the transfer of care. Transition is a long process. It's that process of getting ready to have more independence in your care, make your own decisions instead of having a parent make those decisions for you. Planning out who the adult care team is going to be, and meeting those people, building trust with those people, learning how to navigate the system, learning who do you call, how do you get care when you need it, what do you do if it's 10 o'clock on a Saturday night and the clinic is closed. It's all of those things. And it's also about advocacy for yourself. So in pediatrics, when you're a kid, you've got a lot of people taking care of you, a lot of people who are right there next to you all the time, making sure that that next appointment gets scheduled. And if something's not going well, that you've got mom, dad, a caregiver, grandma, grandpa, whoever it is, speaking up on your behalf. Once we hit, excuse me, that adult world, it's learning about how to be an advocate for yourself. Now, none of that means that once you go through this process of transition to adult focused care, that team of people, the family members, the friends, that support system, they don't disappear, right? And so even as an adult, we still rely on that support. We work with people. We still have family who can come to appointments and help with all those things. But it's a shift in responsibility. And that's, to me, what transition is that shift in responsibility and that shift in where the care is delivered. So it's both the physical reality of receiving care in an adult hospital, an adult focused clinic, but also the shift in, excuse me, roles on that team and who's doing what. Okay. So that's what I mean when I talk about transition. All right. Excuse me just a second. All right. Primary care doctor. So I want to define that because we're talking about primary care. So primary care doctors can be a lot of different types of doctors. So in children's health, that can be a pediatrician who is a primary care doctor. It can be a family medicine doctor who's a primary care doctor. In the adult health world, a family medicine doctor is still a primary care doctor, and internal medicine doctors can be also. A primary care doctor is the person you would go to for a sports physical, for a routine checkup, often for like an ear infection, or, to manage as an adult, to manage any sort of chronic illness. So in primary care, like I was saying before, the job, the role, the idea is this is a place, this is the person who is ultimately responsible for making sure you have what you need for your health. And one of the things that we see happen in sickle cell during childhood, but also in a lot of other chronic illnesses where people have, very specialized needs, is a lot of that routine health, that regular care actually comes from a specialist instead of the general pediatrician or family doctor. And so this idea of having a primary care doctor is sometimes new. Not always, but sometimes. And so that's why I wanted to just focus on it and kind of define what that is. In adult medicine and in pediatrics, in the pediatric world, a primary care doctor is going to coordinate with specialists. So you may see your primary care doctor and then also a hematologist, or say someone with kidney issues might see a kidney specialist. Ultimately, the primary care doctor is going to stay on top of all the recommendations, all the things that are happening from various specialists, and make sure it all fits together in a way that works. Okay, and then the last thing I want to talk about and define is a medical home. So a medical home is a concept, it's an idea, it's not a building, but it's the idea of a clinic where all of that coordinated care, that home base happens. So this is the spot where if you need something, this is your first call. It's the spot where they know you. It's the spot where you don't have to explain your whole health history or who you are or what's happened in your life every time you come in, because the team there knows you already. Generally, that's going to be a primary care doctor, but sometimes, especially in sickle cell during childhood, the medical home might be the sickle cell center where you get care. So that medical home is really important. And that medical home, if there is, say, a sickle cell center where you are able to get all your care and stop in for an ear infection and all of those things, that medical home might be your sickle cell center. Now, in the adult world, more often than not, it's not going to be at your hematology clinic, because in the adult world, a hematology clinic is really just for those specialized issues. And medical home is more commonly going to be in the place where your primary care doctor is. There's caveats to that, because some sickle cell centers, the ones that have more developed programs, often integrate primary care into the sickle cell center. And that's really the ideal. But unless you have access to a program like that, it's really, really helpful and important to have that spot where you consider your health to be, it's like the spot where you feel safe. It's the spot where you feel comfortable, and the spot where they know you and care for you. And that to me is the feeling of a medical home. So now I just want to talk through those three objectives a little bit about how primary care works in sickle cell. So I've been hinting at this, but primary care doctors, I think of as kind of like a wheel. So if you're the hub, if my patient is a hub, or you living with sickle cell, or your child living with sickle cell is the hub of this wheel, there are so many aspects to your life, so many things that influence health, right? So thinking about the things that influence health, one, yes, sickle cell and any complications that might come from that, what medicines you might take, the routine testing, your vaccinations, the pain plan, pain management, mental health, community support, how's school going, the like, does your family have access to everything it needs for you to be healthy? Do you have access to healthy food, a stable place to live? What's your transportation like to get to clinic or get to the hospital or get to school? What all those things, right? And then some of these spokes go out to spots on the wheel that are directly in the healthcare system. So it's what specialists are you seeing? What's it like at the hospital? Do you have a pain plan? All those things. But some of them go out to other aspects of your life that are not directly healthcare related, but still really influence health. So I think of primary care doctors as kind of the ring around the outside of the wheel. We are not the expert on each of those spokes by any means, right? I am not an expert in my patient's school. I'm not a teacher. I'm not a math teacher, but I am able to help troubleshoot a problem like, oh, school's been really hard. I'm struggling because I've missed because of, an illness and I've been in the hospital, or focus has been really hard. I can help troubleshoot those issues and say, okay, well, let's get you letters of support for an IEP at school. Let's do an evaluation for ADHD or dyslexia. Let's piece this together. In the same way, a primary care doctor isn't a lung specialist, isn't able to do specialized testing, but is able to coordinate getting you there, is able to come back. Like, let's say you have an appointment with a specialist and it felt rushed and you still have some questions, your primary care doctor is going to be able to tie that all back together and relate it to all these other spokes, all these other pieces of your life that influence your health. So to me, that is the role of a primary care doctor. Now, when it comes to sickle cell specifically, I think primary care doctors, especially if you aren't part of a comprehensive integrated sickle cell program, are so very important. So as you move from that pediatric world into the adult focused world, primary care really becomes the center point for most care. And it's a way to access specialists. It's a way to access medications. It's a way to get a relationship with a hospital or a healthcare system. Primary care doctors are the door in. So it's really important, especially during that transition period to adulthood, that to identify a primary care doctor, this person who's going to be your advocate, who's going to help bring everything together. And most primary care doctors are not sickle cell specialists, right? The fact that I am is pretty unique, but that doesn't mean that having a primary care doctor who's not a sickle cell specialist is a problem, because they can get you to the sickle cell specialist. They can get you to the hematologist, or they could get you to someone like me who can provide that expert piece for your health. But your health is not just one thing. And that's why having this point person is so important. The other analogy I sometimes use is someone directing traffic. There's a lot of moving pieces in staying healthy when you're living with a chronic illness. And so the primary care doctor can help direct that traffic, make sure things are moving smoothly for you. Ray, I'm going to pause there. I don't know if you have any questions or thoughts that come up just related to the role of a primary care doctor in sickle cell.
Well, it's interesting because I'll be honest, as a parent of a person living with sickle cell disease, when my son was young, it was our primary care doctor that we met before we met the hematologist. It was 2 weeks after he was born. And of course, at birth, he had a newborn screening test. And we received a call from the primary care doctor's office to come in and see them. So I would say, first and foremost, some of that importance of having a primary care doctor starts with the parent and making sure that they are well connected, either before, during, and after childbirth, so that you have that initial connection, and then making sure that that same care then transfers to your child that you just had, whether they have sickle cell or not. So it just so happened that his newborn screening came back positive for sickle cell. I received a call from the doctor, and that was kind of who introduced me to the sickle cell specialist. And that was at birth, right? And admittedly, we did not see his primary care doctor anywhere near as much as it felt like we saw his hematologist. However, we saw his primary care doctor for very different reasons than what we saw the hematologist for. And so, my son had allergies, and he had really bad skin. And so he had eczema. That wasn't the hematologist, right? He had feeding problems early on, and then he had some gut issues. Now that was a matter of the hematologist and the primary care doctor working together, because he ended up having his gallbladder out. But we needed to make sure that all of the people that were part of his care understood that I need that to be in his sickle cell doctor's record, and I need that to make sure that it's in his primary care record, so that if down the road we have a new doctor, we know that it's documented in all of the records that matter. So I think that it was not always apparent to me, the need for primary care doctors. And admittedly, there was a time probably during his elementary school years that it felt like that there was a long period of time that we hadn't seen the primary care doctor. But then he reached this adolescence, and I'm like, oh, we should probably go see, right, those well child checks, making sure he was growing from head to toe properly, really came through having conversations with primary care. And so that value just became more and more apparent. And then when it was time for him to transition, right, transitioning into adult care, I felt like the adult system was so different than what we were used to. It was everything that we thought we understood, we really didn't. And so we didn't understand initially that, okay, we've been seeing our pediatric hematologist who takes care of all of these things outside of his sickle cell, who can write us a prescription for, his inhalers, who is going to make sure that his annual comprehensive clinic includes the pulmonologist and, psychology and all of those pieces. But I didn't realize that in adult care, that doesn't happen in the hematologist. That actually happens in primary care, because, as I call it, you're the wraparound doctor, right? And not just one specialty. You know a little bit about a lot that can help to guide the process. So I think for me, that was what was most significant. And you talked a little bit about that when you talked about the wheel, the hub and the wheel, spoke and wheel model. Because you're right, the patient is at the center, and all of these different spokes that are coming out are all the different facets of one's life that can complicate that little spoke in the middle, right? But there needs to be a connection on the outer edge of all of these areas together so that it improves quality of life. And I think when there's a break in that wheel, when there's a flat tire attached to that wheel, right, it throws the whole thing off. And now your quality of life suffers because one of your spokes, 2 or 3 of your spokes are suffering. But there's a couple of spokes that should be constant. And we know that in hierarchy of needs, we know that housing, food, shelter, safety, those things should ideally be constant. But for the medical spokes, we want to make sure that you are well connected to both your specialty care as well as your primary care. So I love that example. I actually use that example myself because we are complex beings. I think what interests me about you is that I remember meeting you early on in your journey with sickle cell, and I was taken by the fact that you weren't a hematologist. You were the first primary care doctor that I met locally that actually knew more about sickle cell disease than the average doctor outside of a hematologist, right? And though that was a process of teaching and learning, I think that partnership that we had, particularly in my son's care, because you helped to guide how we navigated that process, was really beneficial. And the fact that you took an interest in a condition that many people shun or shy away from, or are frankly can be just overwhelmed by, because there are complexities, right?
Yeah.
And you as a primary care doctor didn't do that. Instead, you leaned into it. And I can say this many years later, I am profoundly grateful for everything that you bring to the primary care space. And I think that the influence that you have and can continue to have on other primary care doctors who may not have that same passion, right? As you said, we're talking to the people out there who are living with sickle cell disease or loving someone with sickle cell disease, and they may not have a Dr. Hannah Lichtsinn. And so maybe one of my questions is, how do you establish that type of relationship with a primary care doctor who doesn't have the knowledge that you have with sickle cell disease, but you would like them to?
Yeah, no, such a good question. And I want to talk about two different things that you touched on. So one is about the that I, as a primary care doctor, had this knowledge different from outside a hematology clinic. And I think that, like you said, sickle cell to doctors, and I don't think a lot of people who live with sickle cell recognize this, sickle cell can feel overwhelming as a physician. It can feel overwhelming to care for someone with a disease this complex and this challenging, and that causes so much pain and hardship for people. And it can feel daunting to do that and to do it well, because we all, as healthcare providers, we want to help our patients. We want to help and do a good job. And one of the things that I think is so unique about sickle cell is that sickle cell, though it's a disorder, a disease that really starts in the blood, is a change in how the blood cells work, it affects the whole body. It affects someone's whole system. And so I think of sickle cell, yes, it's a blood disorder, but really it's an illness that affects everywhere the blood goes. And hematologists and oncologists, though they're trained in blood disorders, they're not, unless it's somebody who has a passion for sickle cell. There's certainly hematologists who are sickle cell experts, but a general oncologist, a general hematology oncology doctor, is really focused in their mind, in their clinical work, on treating people who have cancers and treating the blood disorder. They're not thinking about everywhere the blood goes. But as a general doctor, I am, and my colleagues are too, even if they're not specifically trained in sickle cell and they don't know much about all the issues that sickle cell can cause. They are experts in caring for the whole person and in helping people navigate problems that relate to multiple parts of the body. So when I think about sickle cell and some of the complications it can bring, so it affects kidney health, it can affect lung health, it can affect skin health and bone health and pain and more, right? In general medicine and primary care, so internal medicine, family medicine, and general pediatrics, those are the things we think about. We think about all of these issues. We're not just thinking about the bones. We're not just thinking about the blood. We're thinking about all of it at the same time. And so that's why having someone with that perspective and that training is so important, especially in the adult world. Now, as far as how to find a primary care doctor who either knows something or is willing to learn, sometimes that's trial and error, unfortunately, and I know that can be really hard. Sometimes often I think the best thing to do is to connect, if you have a local community-based organization to support people with sickle cell, it's connecting with that group because they'll know. Here in Minnesota, Ray, who's who, and the right people based on what healthcare system someone might be a part of, or what type of insurance they have, or what part of town they're in.
Shameless plug, contact us if you're looking for some referrals, right? That's true. That's what we are. We're a network of people that care about the outcomes of sickle cell disease. So yeah, you're exactly right.
And if you find yourself with a doctor who doesn't know much, but is willing to learn, fantastic. If you find yourself with a doctor who doesn't know much and doesn't seem interested in learning, find yourself a different doctor if you have that opportunity, because it's really important that that you can trust and lean on and believe in the care that you're going to get from this person. I think that is so important. So that's a really good question.
Yeah, I think that it's also interesting. I mean, you hit on something that's really important, because there's a concept that I refer to teaching the teacher. There is no one that we interacted with that knew us just automatically. We walked in the door, they're like, hey, I had a dream about you. I think I know you perfectly. Like, that doesn't exist. There had to be mutual relationship building, and it didn't happen overnight. So rather, that was our hematologist, and we've had some turnover both in his pediatric clinic as well as in his adult clinics that have required us to rebuild a relationship. But it's also understanding that, because of the complexities of sickle cell disease, because there is varying knowledge and expertise across both the community as well as the medical, the healthcare system, that we are literally constantly wearing I call it 3 hats, right? Because we are wearing this caregiver hat if you're a caregiver or a person who's living with the condition. But then you're also wearing this other dual hat as a learner and a teacher. And knowing, how to twist your cap to the side and when you need to twist it to the other side is not always easy. But the expectation that we walk into a medical facility and they should automatically know about sickle cell disease. Now, I don't want to minimize the fact that we want to spread education and awareness across both communities and healthcare, the healthcare system. However, anytime you're talking about a specialized disease, particularly a rare disease, the reality is that people don't know. They are not an encyclopedia of knowledge coming out of medical school. They build that encyclopedia after years of practice and interacting with individuals like my son, like others that come through the Sickle Cell Foundation of Minnesota, like others who are watching, who are living with the disease. They build their encyclopedia because of us. And so it's important that we recognize that if we were in a classroom as a teacher, we're going to be patient with those students. We're going to understand that there's going to be questions and answers, and we're going to agree and we're going to disagree, and all of those pieces that really come from being a teacher. But then there's also that learning that takes place that says, I'm going to be open-minded to understand things that I may not have understood before. That's one of the reasons we wanted you on the show, because primary care is such an important component that I think sometimes we get so focused on talking about the hematological care that we receive that we forget that, and I love the way you said it, a hematologist is looking at the blood disorder, not necessarily all the places that blood flows. It's not that they don't look at some of those, right? But the reality is that, yeah, there's skin issues. Yes, there's abdominal and gastrointestinal GI issues. There's all of these different areas that your hematologist may not necessarily be an expert on or have the connections in the medical community that your primary care doctor does. And so, ultimately, in a perfect world, like my pie in the sky, I want us to have sickle cell centers, right? Where we can access all of these different spokes to our will under one roof. But until that time, we have to create our own spoke and wheel. We have to make sure that we are tying in all of those pieces and all of those doctors together. So I think it's pretty awesome. And my next question is, it might be a little bit challenging because I love that you call it trial and error. Finding the right doctor can be a trial and error, but unfortunately the system calls it doctor shopping.
Yeah,
that is tough.
Yep.
Let's talk about that.
Yeah, let's talk about it. And then I want to talk about that. And then I want to talk a little bit about what you touched on, the differences between pediatrics and adult systems and
Okay,
how they
let's
work.
do it.
Yeah. Okay. So there's not an easy answer to that question, right? I mean, and that, it's about finding, and that's, yeah. That's why I think, it's about reaching out to community resources, before you make that first step, if you can, right? And that may be, your pediatric sickle cell program or center may know, but it might be community. It might be just word of mouth from other families, or people that like, hey, who's good? And it may be, what you can do is kind of frame a visit. So when going to have a first visit with a primary care doctor, frame it as an established care. And that's a phrase we use, is established care, to talk to them and interview them and frame it that way. And think of it as you interviewing them to see if they will be a good fit for you. And if you are very intentional about that and very clear that that's why you've made this appointment, it won't look or be described in a medical record as like patient has bounced around a whole lot. But if you frame the visit from the beginning as established care, I want to see if this will be a good fit, that allows you to do it more on your terms, and it lets the doctor know what your needs are. Because if you're not clear about what your needs are and what you're looking for, they're just going to go through their usual, like, how's your vision, how's your hearing, how's, review your records, that type of thing. So it's relying on community and then being intentional. But you're right. And certainly, I mean, we could talk for an hour about that, and that's not what we're meant to be talking about.
No, but I love that. I love the way you frame that, because what we have to do is we have to normalize kind of the consult type appointment, where it is not unusual if you are have a needed surgery, or you have an injury and you might need to have consults to find out which is the best doctor. It's the same thing. It's being able to say, I just want an appointment to consider establishing care. But we have to normalize that. Let's talk about that more in the community. Let's make sure that we empower people to be able to do that, because I do think that that's important. It's having a good fit. And frankly, there's certain things I wouldn't buy for my home. There's certain, if I needed a new chiropractor, I would not just, be driving down the street necessarily and be like, oh, a chiropractor's office. Maybe I'll go in there and I'll let him start cracking on me. No, I want to hear from other people who go to chiropractors and say, where do you go? Tell me about your experiences. So referrals and references are super important. And so whether that comes from friends, whether that comes from your other parts of your medical team, whether that comes from your community-based organization, I do think that that's part of what building that network of trust and support is all about.
Mm-hmm. Yeah, absolutely. So I want to talk a little bit about some of these differences between the world of pediatric healthcare and the world of adult healthcare, because they're huge and we probably can't get through all of them. And I know you have a couple other sessions set for talking about transition, and Dr. Boucher will address a lot of these too. But I think of it as this is a trying to put a square peg in a round hole here. It's the image I use when talking about this, but I think conceptually it's more like going to a foreign country, going someplace you've never been, you've never learned that language, you don't know which side of the road the cars are driving on, it's different than what you're used to, the food tastes different, everything's different, and you can learn it. It's just, it takes time and it takes work. And if you didn't realize that when you cross the street you were entering into a foreign country, it can be jarring and shocking. So with sickle cell, with any chronic illness during childhood, you oh, hold on, I have to plug in my computer here, otherwise we'll lose me in a minute. You learn how to navigate the system, you learn who to call, you learn which nurses are going to be the best at drawing blood, you learn who you learn how to navigate this process. And when you move to an adult focused system, it's different, and the language is different, the approaches to care, the expectations are different. So one example I like to use is, in a pediatric comprehensive sickle cell clinic, if a patient, if someone misses an appointment, someone doesn't make it, and this was just a routine follow-up for sickle cell, something like that, probably you're going to get a call. You're going to have someone from the clinic reach out and say, hey, we noticed you didn't make it. Let's figure out why. Let's troubleshoot the issues and get you back in. And in an adult clinic, you might never hear anything. That might just be it. You miss the appointment. There's no follow-up. That's done. It might be that if you miss a couple more, you're not allowed back in that place. And that's a whole other issue we should talk about, but like, we don't have time for that today. But there's not this culture of support that exists in a pediatric clinic. There's an expectation of responsibility that somehow by all of a sudden being 21, being an adult, you now know how to navigate this whole complex system magically in a way that wasn't expected of you when you were a kid. Knowing who to call, when to call, what to say. And it's really challenging. And I can't, again, every healthcare system is a little bit different in how it operates. So what works at, say, Hennepin Healthcare, where I work, might be different than how to navigate things at the University of Minnesota. And so, going through bit by bit the details of how to navigate a system in the adult world isn't that helpful. But what is important, what is helpful, is to have somebody who helps you navigate, have somebody who's there next to you and can say, oh, here's the roadblock we're running into. Let's figure that out. And often, again, if it's a comprehensive sickle cell program, fantastic. But if it's not, it's in the adult world, that person is going to be your primary care doctor and their team. In the pediatric world, it's probably was going to be your sickle cell specialist, but in the adult world, it's going to be your primary care doctor who is able to help you navigate this new system, the new language, the new ways of getting things done. Talk about like, okay, what's the best way to get, to the emergency room? Which emergency room should I use? What time of day is the best time to go there? Is there an alternative? Is there an urgent care? Is there an infusion center I could use? Like some of those specialized things the hematologist is going to help with, but it's going to be a primary care doctor who's able to help explain and open the door into that whole system. Ray, I know we could talk again forever about the differences between pediatrics and adult healthcare worlds, but what, from a primary care standpoint, what do you think is important?
I think that, just as you said, I think that it's about having someone who is familiar with all aspects of your health, and making sure that you utilize your primary care team in that way. That's what they are there for. That's why they are considered a medical home. And that is, I think that being able to expect a level of whole person understanding from your primary care doctor sometimes feels a bit more realistic, because that's what they are, that's what they're experts in, right? And I'll just say this, not every hematologist is a great, perfect hematologist. Not every primary care doctor is a great or perfect primary care doctor, but I do think that it is important to see people's strengths for what they are. And if it is a knowledge gap, then put on your teacher's hat, keep on the learner's part, but also put on your teacher's hat, allow the process of building the relationship. That doesn't happen. I'm not going to go on one date and decide, yep, I'm, you could be my spouse, right? That's you. There is a process to building that relationship. I want to better understand us over time, how we work. So yes, you go in and you have that kind of initial consultation, and then if it feels right, you continue, but you're still building that relationship process. And I think that's the key with any doctor, but particularly your primary care doctor, so that they can get to know you. There has to also be an ability to be transparent and really have hard conversations. Sometimes we as individuals in the sickle cell community who are living with or caring for someone don't always feel that we have a safe space that we can talk about, these things. If I'll just use, for example, as a caregiver, my child is spending an exorbitant amount of time in their bedroom. What do I do? Or as a person living with sickle cell disease, I just have a hard time getting out of the bed. Yes, I'm achy and in pain, but mentally I'm just drained, and I just don't feel like, I just cry a lot and I just feel sad all the time, right? You have to be able to have that safe space to be able to talk to someone that cares about you beyond the beyond in medically. And so that they can be putting their think cap on to say, you know what, let's consider this, let's consider this, let's consider this. Let's look at your diet. Let's look at your vitamin D. And then let's look at, maybe there's opportunity for you to see someone to talk with. Who are the strengths in your community, right? They're going to have more of those types of conversations that I think really help to build who you are, and they're able to pull in other people that help to build the team.
Yeah. So this is my last slide here, was just talking about how to build your own team, a team that works for you. And really your needs are your needs. Like, no two people need the exact same team, because your team is going to reflect who you are, what your strengths are, and what your medical needs are, and what your other support needs are, right? So, it may be that you need a hematologist on your team to help with chronic transfusions. You need a primary care doctor to coordinate everything. You might need other medical specialists like a kidney doctor or a lung doctor. You might need some access, you might need support, right? Like, how do we get insurance set up? So having someone on your team who can help set up, navigating the insurance system to make sure you have insurance coverage lined up as an adult, making sure you have someone who can help navigate, disability services, if that's something that you would benefit from. And then, your team also includes your family support, your community support, right? Those people are probably in many ways as important, if not more important than who the actual doctors are that you're seeing. So it's thinking about really broadly who this team is and what are the pieces that you need. And it may be that there's one doctor or one clinic that can fulfill a lot of this all at once, and that's great, right? If you have access to a comprehensive sickle cell program, or a team that is really dedicated to it, or a medical home that maybe isn't sickle cell specific but has a lot of those resources integrated into it for, all those support pieces, fantastic. But it might be for some people, especially if you're not in a major metro area where there's big hospitals that have specialists, it might be that you're pulling these pieces together from lots of different areas. And that's harder work to build that in that case. But it's still important to build that team, because none of us live in isolation. None of life happens alone. We all rely on other people for support in various ways. And I think that thinking about, what are, from a health perspective, especially from a health care perspective, what are the things that you as someone with sickle cell need to be healthy and to live well, and making sure that your team reflects all of that. So with that, let's just, Ray, as you reflect on kind of the things we've talked about, what other questions do you have, or things that I didn't talk about that you'd hoped that I would?
Well, number one, I think that we talked about a lot really is the importance of having a primary care doctor on your team. And using that word team, it's about building your team, right? And that primary care doctor can help you to do that on the medical side. And you also mentioned the importance of family, community, spiritual advisor, right? We don't often talk about the the team outside of the medical team, but building your village, right? It is critically important because not everyone that you run across or interact with is going to be part of that inner village. And so building that requires you to be intentional, and it requires some trial and error. I do think that in the almost 20 years that I've been working in the sickle cell space, even outside of caring for my own son, I do think that although it's been slow, that there is some momentum around providers really being advocates for their patients and identifying ways to make things better internally in the healthcare system. That has been a need for a very long time. I don't think that that's any secret to anyone. And we talked about some of those things, such as, stigma, doctor shopping, all of those things that in a typical conversation, there's a healthy word for it, but somehow when attached to sickle cell disease or other chronic illnesses, there's a negative stigma that's put that is assigned to it. And I think that it's up to us to redefine that narrative and to say this is part of our rights as a consumer of healthcare, and that we are going to do that, but we're also going to do that with a level of knowledge so that we can make informed decisions along the way. Everyone is not for us, but everyone is not against us either. And it's knowing who your champions are, and building a team based on who those champions are for your health and your wellness, because all of you, head to toe, body, mind, and spirit is part of your wellness, is part of your health. And so we cannot forget that. So I'm so grateful to you, Hannah. And I have to apologize because I'm so used to calling you Hannah. I don't always call you Dr. Lichtsinn. Like when we're in public, I'm like Dr. Lichtsinn, but it's like another Zoom meeting that we're on.
I know, right?
So
no, don't worry about it. I'm Dr. Hannah to most. I married into my last name, so it's a hard one. So
awesome.
Yeah.
Awesome. But I appreciate that. And I think that our biggest ask as the Sickle Cell Foundation of Minnesota, and you're already doing it. So number one, we want to say thank you for being the advocate that you are. And our ask is that you continue to advocate in those spaces that you have influence, so that other people can see the beauty of working with the sickle cell community and working with individuals living with sickle cell disease, and that we are more than our disease. We are more than our last crisis. We are more than the pain medications that help to give us function and quality of life. We are so much more than that. And it takes all of us to create that village and to spread that word outside of the village of who we are and the life that we have and what we bring. And so I appreciate that. I look forward to continued partnership. Thank you to Hennepin Healthcare for all that they are doing in the community to bring resources and a deeper level of empathy into the challenges that are attached to those spokes on people's lives. And so thank you very much. If you are joining us live, we thank you for joining us. If you are viewing this on our YouTube channel and our replay, be sure to check out the other sessions that we also have. Just to close us out, I'm going to go back and share my screen once again, which is a process. So I'm gonna keep talking until it shows up on the screen. All right, so once again, give us a couple of hours and then we'll get this uploaded in the full version. Many of you may have missed the first few minutes if you were watching live, because we had some technical difficulties, but the live full version will be on our YouTube channel, where we are building a repository of all of our videos. We are very excited also later on. Well, I can say this evening, but depending on when you watch this, there will also be a video in our YouTube repository. Dr. Alex Boucher talking about transitioning from pediatric to adult healthcare. And that is a town hall style conversation where we will open it up. We will be live. They were registered attendees, as well as doing this live on Facebook again, so that we can create a dialogue. We want to hear from people about your experiences and what would make transition better. And then later on this month, we will also have Dr. Nikki Anderson, who will talk about neuropsych testing in childhood and pediatrics, and the importance of having those testing to better understand how sickle cell disease impacts brain function. I am super excited because next week We will also have another live panel session with a live warrior panel, smiling through the pain. What's in your toolbox? Now, y'all know what I mean when I say smiling through the pain. I'm not saying we always smile or that it's easy, but very often we have to put on this mask and we have to put on this front that allows us to even tolerate any level of that pain. So we're going to talk with individuals from sickle cell disease warriors, individuals living with sickle cell disease, caregivers, and the adult child of a person living with sickle cell disease, and how watching his mother as a child and teenager, how that impacted his life and the pain that he felt watching her pain. So I'm really excited about this panel. Myself and Velvet Brown Watts, y'all know who she is. She is, the two of us will be co-moderating this panel. And then last but not least, don't forget to order your Sickle Cell Warrior resource package. We are always going to shamelessly plug the need for additional bone marrow registrants. We want you to join the match, be the match bone marrow registry. All right, I got that out. The reality is there are cures for people with sickle cell disease. No, it's not a universal cure. No, everyone does not qualify yet. But for those who do, those matches come from people that look like you and I. Those matches come from people who have the most similarities in their bloodlines. And so we need more Black and brown people. Let me just call it out. Anything that is for us has to be with us. You hear me say it all the time. Newsflash, we are the us. So we have to participate, sign up, get your friends, your family, your mama, your daddy, your cousin, tell them we need you on the registry. And then last but not least, probably the easiest and fastest thing you can do to help, if you really want to lend a hand, lend an arm, donate blood, save lives. Here in Minnesota, we have two major blood banks that is the American Red Cross and Memorial Blood Centers. I will tell you, just as a brief bit of knowledge, along with many other hospitals, American Red Cross does in fact supply blood to the University of Minnesota. Memorial Blood Centers does in fact supply blood to children's hospitals and clinics of Minnesota. And so, and again, that's amongst others. That's just a couple of the many. But donate blood. It is a quick process, and truly we are in a situation where that we've not ever seen in the shortage of blood. And anytime we have a blood shortage, we also have a challenge with matching blood to the right donors. We don't want to add complications by not having the right matches. So donate blood, save lives, make an appointment today, join the Be the Match registry. All right, on that note, we appreciate you joining us. We'll see you next time for Living Sickle Smart with Sickle Cell Foundation of Minnesota. Thank you so much, Dr. Lichtsinn. We appreciate you showing up on our show. I'm Ray Blaylock, and we'll see you next time.
Bye.